Welcome. If you have started mapping the bathrooms before you leave the house, if the second trip out of bed at night has become normal, or if a cough or a laugh now arrives with a small worry attached, you have probably been told the same thing everyone your age is told, that this is simply what happens. The National Institute on Aging is more precise than that. It describes a bladder that changes with time. The elastic tissue can toughen and become less stretchy, so it holds less than it used to. The bladder wall and the pelvic floor muscles can weaken, which makes full emptying harder and leaking more likely. That is a description of a mechanism. A mechanism is something you can work with. Before we go further, this AI-generated presenter is a persona, not a real or licensed physician. Blood in your urine, fever with back or side pain, burning that will not settle, a sudden inability to pass urine at all, or new leaking that arrives with weakness, numbness, or confusion needs medical assessment now, not a grocery list. And if you live with heart failure, kidney disease, diabetes, an enlarged prostate, or take a diuretic, your own clinician's fluid plan overrides everything said here. This is general education about ordinary foods. Here is the number that should reset the conversation. The National Institute of Diabetes and Digestive and Kidney Diseases states that approximately half of all women experience urinary incontinence, and that as many as 1 in 3 men over the age of 65 may lose urine by accident. Then the same federal source adds the sentence, almost nobody repeats. Although it is common, it is not a routine part of being a woman or of getting older. Sit with that for a moment. Common does not mean permanent, and common does not mean untreatable. It means a great many people are quietly managing something that has documented ordinary, unglamorous responses. The National Institute on Aging puts a scale on the organ itself. Adults pass about 1.5 quarts of urine through the bladder each day, and the agency suggests using the bathroom at least once every 3 to 4 hours, rather than holding urine for long stretches. We are going to count down 6 foods and drinks that support a healthy bladder, and I want to be honest about what that phrase means before we begin. None of them treats incontinence. None of them repairs a pelvic floor, and number 1 is not cranberry. The most famous bladder item in the entire grocery store is studied for a different problem, and the agency that reviews it uses the words limited and inconsistent. Stay with me through all 6, because that distinction may keep money in your pocket. Tell me your age in the comments, and tell me which one bothers you more, the trips at night or the sudden urgency during the day. One boundary before I tell you how to open the guide. It is not an incontinence program. It does not replace an examination, a bladder diary reviewed by a clinician, pelvic floor training taught by someone who can check your technique, medication, or a prescribed fluid plan. It gathers general habits around food, movement, sleep, and healthy aging, and nothing in it should displace the instructions from the person who knows your history. And in just a moment, a code will appear on your screen. Scan it with your phone, and it will open. The 90-year blueprint, a free guide to ordinary food, movement, sleep, and healthy aging. It is a gift. There is nothing else being offered on this channel. Save it, read it slowly, and bring anything that touches a diagnosed condition to your own clinician first. Now let me set the rules for this list because they are unusual. Rule 1. 2 mechanisms carry every item and only 2. The first is pressure. The National Institute on Aging states that too much stool built up in the colon can press on the bladder and keep it from expanding the way it should, and it names high-fiber foods, enough water, and physical activity as the way to prevent that. The second is substitution, because the same agency lists sodas, artificial sweeteners, spicy foods, citrus fruits and juices, and tomato-based foods among the things that make bladder problems worse for some people. Rule 2. Every item on this list is either fiber that reduces pressure or a gentle replacement for something on that irritant list. That is the whole framework. Rule 3. Irritants are individual. Some people react to coffee and not to tomatoes. Some react to neither. Number 6 starts at breakfast. Number 6 is oats and whole grains. The mechanism is fiber, and the target is a real number. The National Institute of Diabetes and Digestive and Kidney Diseases states that depending on age and sex, adults should get 22 to 34 grams of fiber a day. The same agency's list of fiber sources names oatmeal, bran cereals, whole wheat bread, and whole wheat pasta directly. Connect that to the bladder through the pressure mechanism. A colon that stays full presses on an organ that needs room to expand. Fiber is the least dramatic tool for that job, and it is the one federal guidance keeps naming. Now, the second reason oats earn the 6th spot, which has nothing to do with fiber. Breakfast is where most bladder irritants enter the day. The Food and Drug Administration notes that an 8-ounce cup of coffee contains closer to 80 to 100 milligrams of caffeine, and that 400 milligrams a day is the figure cited as not generally associated with dangerous effects in healthy adults. That figure is about general safety, not about your bladder. The National Institute on Aging is the one that says caffeinated drinks can bother the bladder and increase frequency and urgency, and that cutting down may help. So a warm bowl of oatmeal does 2 jobs. It adds fiber, and it occupies the part of the morning that would otherwise be a 3rd cup of coffee. There is a warning attached to fiber, and it matters more here than anywhere else. Add it gradually. The same federal guidance says to add fiber a little at a time so the body gets used to the change, and to drink liquids so the fiber can work. How to add it? Start with half a serving of oatmeal or a whole grain bread at breakfast this week, not a full overhaul. Skip the flavored instant packets heavy with added sugar. If you have celiac disease or a gluten disorder, choose the grains your own plan allows. Number 5 is pears and apples eaten with the skin. The named source is the same federal fiber list, which places pears and apples with the skin among its recommended fruits, so they carry the pressure mechanism. But they are on this list for the second mechanism, and this is where a bladder episode stops looking like every other nutrition video. The National Institute on Aging lists citrus fruits and juices among the foods that some people with bladder problems find make their symptoms worse. Tomato-based foods appear on that same list. Think about what that means practically. A person told to eat more fruit reaches for orange juice at breakfast and a grapefruit at lunch, and then cannot understand why the urgency got louder. The advice was not wrong in general. It simply collided with an individual sensitivity that federal guidance already anticipated. Pears and apples are the answer to that collision. They are lower in acid, they are recommended by name as fiber sources, and they let you follow the fruit advice without walking into the irritant list. I want to be careful here because this is where nutrition talk usually overreaches. A pear does not calm a bladder, it does not strengthen a pelvic floor muscle or reduce leaking. What it does is let you meet a fiber target using something less likely to provoke you than the citrus you are reaching for. And test it yourself rather than trusting me. The agency's own language is that some people find these foods make their problems worse. Some, not everyone. How to add them? Keep a bowl of pears or apples where you can see them. Eat them with the skin on for the fiber. And if chewing is difficult, a stewed or baked pear with no added sugar keeps the fiber and softens the texture. If you take a medication that requires a stable diet, mention the change. Number 4 is cooked vegetables, specifically carrots, broccoli, and green peas. These 3 are not my selection. They appear by name on the federal list of vegetables recommended for fiber alongside collard greens. When a countdown item can point at a government page and say the name is printed right there, that is worth more than a paragraph of enthusiasm. The mechanism is the same pressure mechanism, approached from a different angle. Fruit fiber and grain fiber are easy to remember. Vegetable fiber is the one people skip, and it arrives with water already inside the food, which matters for a reason we will reach at number 1. Here is the practical detail that decides whether this item survives in a real kitchen. Cooked vegetables are easier than raw ones for many people over 60. Chewing changes. Dentures change what is comfortable. Appetite shrinks. A plate of raw crudités is a photograph, not a habit. Carrots roasted until they are sweet, broccoli steamed until a fork goes through without resistance, or frozen peas warmed in a minute are all realistic on an ordinary Tuesday. Frozen counts. Frozen vegetables are picked and packed quickly, and they do not spoil in the drawer while you decide. If cost or transport is a barrier, frozen is often the version that actually gets eaten. One honest note about spice. The same federal list that flags citrus also flags spicy foods for some people with bladder symptoms. So if you have been adding chili to make vegetables interesting, and your urgency has been worse, separate those two variables before you blame the vegetable. How to add them? Pick one dinner this week and put 2 of these 3 on the plate. Roast a tray of carrots, keep frozen peas in the freezer, and steam broccoli rather than boiling it into surrender. One dinner, repeated, beats a perfect week you cannot sustain. We are halfway. If you find it useful when someone separates what a food actually does from what a label implies, subscribe and stay. That distinction protects your health and your wallet. And tell me which of the first 3 is already in your week. Oats, pears, or cooked vegetables. Now the item with the most fiber per serving, and the one people avoid for the wrong reason. Number 3 is beans, lentils, and chickpeas. The federal fiber list names lentils, black beans, kidney beans, soybeans, and chickpeas as legume sources. Per ordinary serving, this group is the densest fiber on the entire countdown, which makes it the strongest lever on the pressure mechanism we have been building toward. Let me restate that mechanism precisely, because it is the spine of this episode. The National Institute on Aging states that too much stool built up in the colon can put pressure on the bladder and keep it from expanding the way it should, and that eating plenty of high-fiber foods, drinking enough water, and being physically active can help prevent it. That is not a food treating a bladder. That is a food removing a load from a neighboring organ. Now, the reason people avoid legumes, gas and bloating, especially when someone eating very little fiber suddenly serves themselves a large bowl of chili. That is the exact scenario federal guidance warns about when it says to add fiber a little at a time. The discomfort is usually a pace problem, not a bean problem. Legumes are also the most economical item here by a wide margin. Canned beans need only a rinse, which also washes away some of the surface sodium. Dried lentils cook in about 20 minutes without soaking. Neither requires a specialty store or a subscription. One caution that belongs to this list specifically: if you have chronic kidney disease, potassium and phosphorus in legumes may be limited in the eating plan your clinician gave you. That plan wins. Nothing in a general education video outranks a prescribed diet. How to add them: replace half the meat in one familiar dish with rinsed beans or cooked lentils, and start with a half-cup serving rather than a full one. Soup, chili, and pasta sauce all accept this change without anyone at the table noticing. Number 2 is water-rich foods and clear, broth-based soups. Here, the two mechanisms finally merge. Federal constipation guidance says plainly that you should drink water and other liquids, including clear soups, to help the fiber work better. Fiber without fluid is not a complete tool. It is half of one. And water-rich foods are how fluid arrives without a decision. Cucumber, lettuce, melon, zucchini, and a bowl of broth-based soup all deliver water inside food spread across the day in small amounts that do not land in the bladder as one sudden volume. That last part matters more than it sounds. Many people with urgency drink almost nothing all afternoon, then a large glass with dinner, and the bladder receives the entire day at once. Foodborne fluid is naturally paced. Notice which soups I named. Clear and broth-based, because tomato-based foods sit on the National Institute on Aging's list of things that worsen symptoms for some people. If a creamy tomato soup has been your comfort meal and your evenings have been difficult, that is worth testing. Sodium deserves a mention. Canned and packaged soups can be high in it, and if you have been told to limit sodium for blood pressure, heart failure, or kidney disease, read the label or make a simple broth at home. Choosing lower sodium versions is a small change that keeps this item compatible with most prescribed plans. Melon is a gentle choice worth naming separately. It is water-dense, low in acid, and easy to eat when appetite or chewing is limited. If you manage blood sugar, fit the portion into the plan you already follow rather than treating fruit as unlimited. How to add them: put one water-rich food at lunch every day for 2 weeks. A few slices of cucumber, a cup of melon, or a mug of broth. It is the smallest change on this list, and it makes number 1 possible. Number 1 is plain water, and it is on this list because it is the item most people with bladder symptoms deliberately take away. The logic feels sound: less in, less out, fewer trips, fewer accidents. So the glass beside the chair goes unfilled. The afternoon passes dry, and the person waits. Federal guidance goes the other direction. The National Institute of Diabetes and Digestive and Kidney Diseases says to ask your healthcare professional whether you should drink less liquid during the day, and then adds the correction directly. Do not limit liquids to the point of becoming dehydrated. The National Institute on Aging gives a usable target that requires no measuring cup. Drink enough fluids so that you need to urinate every few hours. It also states that some people need to drink less because of conditions such as kidney failure or heart disease, and that you should ask your healthcare provider how much fluid is healthy for you. Read those 2 sentences together, and you have the honest answer: not more, not less. Enough. Defined by your own body and your own clinician. Now, the cranberry promise I made at the start. The National Center for Complementary and Integrative Health reports that cranberry products may reduce the overall risk of symptomatic, recurrent urinary tract infections in women by about 25%, and in some cases by more than 30%, while also stating that effectiveness remains in question because of inconsistent findings, that results in elderly people have been inconsistent, and that cranberry is not recommended as a treatment for an existing infection. The agency also notes conflicting evidence about whether cranberry interacts with the blood thinner warfarin. Every word of that concerns infection, not leaking, not urgency, not the trips at night. The most famous product in this aisle is being sold to people for a problem it was never studied to solve. How to do this one: keep a filled glass somewhere you sit, sip through the day rather than in large amounts. And if evenings are your difficulty, ask your clinician about shifting more of your fluid earlier rather than cutting the total. Now let us put all 6 back together, because separated into individual nutrients, this list becomes exactly the kind of claim I have spent 20 minutes refusing to make. Oats and whole grains bring fiber and take the place of an extra cup of coffee. Pears and apples bring fiber without the acid of citrus. Carrots, broccoli, and green peas bring vegetable fiber with water already inside. Beans, lentils, and chickpeas bring the densest fiber per serving. Water-rich foods and clear soups let that fiber work. Plain water sets the whole system in motion and is the one item people wrongly remove. 2 mechanisms. That is all this list has ever been. Reduce the pressure from a full colon and replace the things that federal guidance says bother the bladder for some people. Notice that 5 of the 6 are simply fiber and fluid arriving together, which is precisely how the National Institute on Aging frames constipation prevention. High-fiber foods, enough water, physical activity. The food half of that sentence is the entire countdown. Now name what this pattern cannot do, in plain words, so that nobody leaves with the wrong expectation. It cannot strengthen a weak pelvic floor. Only training those muscles does that. It cannot calm an overactive bladder muscle. It cannot treat a urinary tract infection, and no fruit or juice should be used in place of medical care for one. It cannot shrink an enlarged prostate blocking the flow. It cannot correct pelvic organ prolapse. It cannot repair nerve damage from diabetes, multiple sclerosis, Parkinson's disease, or a stroke, all of which the National Institute on Aging lists among the causes of longer-lasting bladder control problems. And it cannot tell you which of those you have, which is the single most important thing to know. So where does the real leverage sit? Federal sources are unusually clear about this. The National Institute of Diabetes and Digestive and Kidney Diseases states that strong pelvic floor muscles hold in urine better than weak muscles, and that those muscles can be strengthened with Kegel exercises. It describes bladder training, urinating on a schedule, and gradually lengthening the time between trips as a way to help the bladder hold more. It states that losing weight can help you have fewer leaks, and that avoiding weight gain may prevent the problem. It says limiting caffeine may help reduce leaks, and that alcohol should be limited because it increases how much urine the body makes. Food is not the headline of that paragraph. It is the supporting cast. Fiber removes an obstacle so the rest of the plan can work. That is a smaller promise than most videos on this subject make. It is also one you can verify on a government page tonight, which is more than can be said for a bottle with a picture of a bladder on the label. If you do only one thing from this entire list, make it one fiber item plus enough fluid, repeated daily for a month. A pattern earns its results through repetition, not intensity. And if you take away only one sentence, take the federal one. Common is not the same as normal and not the same as permanent. Food was the smallest part of this. Here is the rest, and it matters more. First, get an accurate name for the problem. The National Institute on Aging describes several distinct types. Stress incontinence, where urine escapes under pressure from coughing, sneezing, laughing, lifting, or exercise. Urge incontinence, a sudden need that cannot be held long enough to reach a toilet. Overflow incontinence, small leaks from a bladder that never fully empties. And functional incontinence, where bladder control is normal, but arthritis or another condition makes reaching the bathroom too slow. Those 4 have different causes and different treatments. A video cannot examine you, review your medicines, or tell them apart. Second, learn the pelvic floor exercises properly rather than from a diagram. Both federal sources place them first. Many people squeeze the wrong muscles for months and conclude the exercises do not work. A clinician or a pelvic floor physical therapist can confirm you are contracting what you think you are contracting, which is the difference between a technique and a habit. Third, ask about the 2 behavioral tools most people are never offered. The National Institute on Aging describes urgency suppression using stillness, slow breathing, distraction, and a pelvic floor squeeze to let a strong urge pass, and timed voiding, going on a schedule, and gradually extending the interval. Neither costs anything. Fourth, review your medication list with a pharmacist or clinician. The National Institute on Aging notes that some medications make leaking more likely, and that drugs which calm the nerves for sleep or relaxation may dull the bladder's signal so the urge is not felt in time. Diuretics change timing considerably. Do not stop anything on your own. Ask whether the timing or the choice could be adjusted. Fifth, keep a simple diary for 3 days before your appointment. What you drank and when you went, when leaking happened, and what you were doing at the time. That single sheet of paper will do more for your visit than any list of foods. And know the signs that should not wait. Blood in the urine, fever with pain in the back or side, burning or cloudy urine, a sudden inability to pass urine. Leaking that begins alongside weakness, numbness, or trouble speaking. Those need prompt medical attention, not a shopping list. There is a particular kind of shrinking that this problem causes, and it happens quietly. First, you choose the aisle seat. Then you stop drinking anything after 2 in the afternoon before a long drive. Then you decline the trip, the concert, the grandchild ceremony, and you tell everyone you were tired. The goal here was never to promise that 6 foods hand back the bladder you had at 40. It was to remove one wrong idea, that this is simply age and nothing can be done, and replace it with a sentence from a federal health agency that says the opposite. Share this with someone who has quietly started planning their day around bathrooms and has not told a single person about it. One last safety reminder. Blood in the urine, fever with back or side pain, burning, a sudden inability to pass urine, or leaking that arrives with weakness or confusion needs assessment now. If you have kidney disease, heart failure, diabetes, an enlarged prostate, or a prescribed fluid or potassium limit, follow your own care team rather than any general list. Nothing here diagnoses a bladder condition or replaces treatment chosen for your history. The code on your screen opens the 90-year blueprint, the free guide I mentioned earlier. Scan it or use the link in the description, and keep only what fits the guidance you already follow. Subscribe if you want explanations that tell you where the evidence stops rather than where the marketing begins. And tell me in the comments which single change you will make first. The fiber or the fluid? Choose one, repeat it for a month, and take good care of yourself.